Now, one country that is seeing a rise in cancer cases as well as trying to fight the rising costs of treating it is Ghana, where hospitals are seeing more and more patients. Health experts say there are more than 200 different types of cancers being seen in Africa. The International Atomic Energy Agency estimates Ghana can expect 50,000 cases annually. This rise in cancer is evident at treatment centers such as the National Center for Radiotherapy and Nuclear Medicine in Accra's Kolebu Hospital. Comfort Owosu has breast cancer.
I was on the bed when the junior doctor told me that, "Madam, do you know you have cancer?" It was just that. Honestly, that broke me down, and I felt that was going to be the end of my life. It wasn't easy for me. Right from there, I think I started having some psychological problem.
Lack of understanding about cancer has led to discrimination of some that are diagnosed with it. Breast cancer survivor Lillian Badu says as a result, many people with cancer choose to keep the news to themselves.
Normally, when you tell people, it looks as if they put stigma on you. And some even go to the extent to insult you with it. And if you don't tell anybody, nobody knows anything. So you are free.
Some cancers can be cured if detected early, but there is a shortage of medical facilities for cancer patients, especially for those in rural areas. Many patients cannot afford the high cancer treatment costs. Basic radiotherapy treatment ranges between $500 to $1,000, while chemotherapy and other treatments can range from $20,000 to $30,000. This is the challenge for Agnes Donyo, who has cervical cancer, which, according to the World Health Organization, is the leading cause of death of women in Ghana.
Money is my problem at the moment. The debt I owe here I cannot pay, so I couldn't do some of the treatment.
Director George Dakpala of Ghana's Ministry of Health says while government provides most health care under the National Insurance Scheme, it cannot make specialized cancer treatment available for everyone who needs it. The country has radiotherapy machines in only 2 hospitals, Kolebu and the Komfo Akonye Teaching Hospital.
From time to time, government also sponsors some of these patients, either locally or outside to have some treatment. But I believe it will take us a bit of time before we can arrive at the situation where the costs of treating these cases will be quite manageable to the general population.
Clement Edusa, a doctor at the Kolebu Hospital, says the high cost of treatment drives many to seek alternative, often less effective courses of treatment.
Unfortunately here, the first place of call is either your pastor in church, who would send you to a prayer camp, work you off 2-3 weeks before they send you to the hospital, or most of the times the traditional healers, who also give herbal concoctions, which also most of the times don't work, so that person is delayed in the process of treatment.
A recent conference in Accra reveals that breast and cervical cancer are the most common cancers affecting women in Ghana. The conference cited poor rates of awareness, screening and early detection as factors in the rates of disease.